Good afternoon, everybody. I'm Jody Hanson, Director of Public Affairs and Communication for Johnson County Government. We apologize for being a few minutes late. There was a meeting that ran right up to this one, and so we're here now, and we're just going to get started. Dr. Ariola, Elizabeth Holshu, thanks for being here today, and Robin, thank you for being our ASL interpreter. Dr. Ariola, what is today's update that you'd like to share with everybody to get us started?
Thank you, Jody, and good afternoon, everyone. I will start out by saying that our clinic today, which really was the clinic that we had to cancel last week, Tuesday, ran very well. We vaccinated about 1,020 persons there today. And so that's pretty good. And tomorrow, Thursday and Friday, as well as next week, Tuesday, we're going to be vaccinating, giving first doses to mostly people in our 80 plus group. Those are going to be the last three clinics that are focused largely on this group. Moving forward, our clinics are going to be 65 plus. And so that takes me to our plan for next week. So next week, Wednesday, we're going to have a clinic that's focused on 65 plus. And so that's going to begin of course, if you are 80, you still qualify. We'll walk you into those clinics, but clinics are now going to be targeted towards 65 plus. And that's similar to what you will see with our health systems, our hospitals. That is similar to what you will see with pharmacists that are giving out those shots. And so if you're 65 or older, you would be able to book one of those appointments beginning Wednesday. I believe those appointments should be ready to go out later today or tomorrow. And on Thursday and Friday, there's been quite a few of you that have had questions about getting your second doses. So pretty good news. Our Friday clinic is going to be targeted towards Moderna vaccine. So again, if you are on our list and you are due your second dose of Moderna, you should have that opportunity next week, Friday. And for those that are due Pfizer vaccine, you should have that opportunity on Thursday, next week, Thursday. Now, it is possible that we're able to work in some additional Pfizer to the Moderna doses on Friday, but we're working on those logistics. So the message today is, if you are due your second dose of Pfizer, you will have an opportunity to get that vaccine on Thursday. And if you're due your second dose of Moderna, you'll have an opportunity to get that on Friday. So those are the plans for next week. And right now, like we mentioned yesterday, we did get some good news about additional doses coming to our schools. So I would have Elizabeth talk about the schools, but also we have been working on how to improve our process for second dose appointment. And so we don't want you to be doing that multiple times. So beginning from tomorrow, we're making some adjustments, and she'll talk through how one appointment will be all that you need. And after you, when you get your, either make your first appointment or beginning tomorrow at checkout, that we're providing you information about when and where you need to be for your second dose. Elizabeth?
Thank you, Dr. Ariola. We know that there's been some frustrations about getting that second dose appointment scheduled, and we've been trying to send emails, but we know that individuals have been missed. And so we're hopeful that this change will be an effective way to get people scheduled for their second appointments without a lot of headaches on either end, either ours or yours, as patients waiting very excitedly for your second dose to get fully immunized. So what we're going to start doing is, with Pfizer, we have a 3-week time, 3 weeks in between your first dose and your second dose. So starting tomorrow, as Dr. Ariola said, what we're going to do is you will be automatically scheduled for your second dose appointment exactly 3 weeks from your first dose at the same time and at the same location. So for instance, if you are getting your vaccine tomorrow, we'll be providing information saying that your second dose will be 3 weeks from that point, and you will just need to show up at that same time on that date. And so we'll be providing that information when you check out, or in future times, if you are scheduling your very first appointment, you'll be getting that information at that moment. So we're hopeful this takes away some confusion and some frustrations and ensures that everybody can get immunized on time. And I will say that the reason why we were not able to implement this at the beginning was because while we were told that we would have second doses being shipped in a timely manner, because of some hiccups in those doses being delivered, we weren't sure that we could rely on that. And we definitely did not want to be scheduling appointments and then having to cancel them and sort of scramble in the end. And so now that we've been doing this for a couple of months, we are tending to get those second dose shipments in a timely fashion when we expect them to. And so this really allows us to really set up some framework for us to be able to do that more efficiently moving forward.
Well, that's exciting news. So just to recap, for maybe people that just joined us, so starting tomorrow, when you make your first dose appointment, your second dose is automatically scheduled exactly 3 weeks later, same time, same location, 3 weeks from the calendar. So what if somebody, as that date gets closer, realizes, oh, that date's not going to work for me, or even when they make their first appointment, they know that that exact 3 week date isn't going to work. Are there options, or should people really be focused on being available for both those dates 3 weeks apart?
So there would be options. I think there's plan to send a reminder about a week before that second dose comes in. But if you can't make that date, you call us and we'll do all that we can to reschedule you. But this will take, that should be just a handful of people versus trying to reschedule to make thousands of people book appointments. So either way still makes life easier for you as well as for our process. So there will be options there.
It sounds like great news.
Yeah, and Elizabeth, I know you were, so to be clear, tomorrow, you've already made your appointment, but at checkout, you will be provided information similar to what Elizabeth said, which is that you show up at the same location, at the same time, 3 weeks from then. Of course, they will be telling you the specific date when you need to be there. So that's really good news. We've been trying to improve that process for a while, and pretty happy that we're able to do that now. So.
Great.
I wanted to, I'm sorry, I asked Elizabeth to also talk about schools.
Yep.
And so maybe those are two separate questions that I should not have lumped together. But now, unless there's other questions about second dose, I do want her to talk about schools as well as the CDC travel requirements. We're getting a lot of questions about that. There is, and so very important to be clear about what those recommendations are. Yeah.
Sounds great.
Absolutely. So we have been talking about how excited we are. We've received additional doses from KDHE to focus solely on our K through 12 educators, both public and private and parochial schools. And so over the last few days, since we got this information on Saturday, Children's Mercy, in partnership with Johnson County, has been really trying to work out what that schedule looks like over the next few weeks in terms of getting individuals their first doses and then also getting them their second doses. And so this coming week, we actually have a clinic this Saturday where we're going to immunize about 2,300 individuals from K through 12 schools. And then next Tuesday night, we will be doing around 1,200 individuals from our licensed childcare centers and homes. And we will also have 2 more clinics next week for our K through 12 educators to again immunize about 2,300 with their first doses. And so we'll be rolling out a lot of vaccine clinics for this group. And one of the pieces that we've been looking at is spring break. And we know that spring break is coming up for a lot of our schools, a lot of the students. And I know that this has been a hard year for everyone. And I think that a lot of individuals are considering traveling, potentially even internationally. So CDC has come out with some new guidance, and that's what Dr. Ariella is hoping that I will talk about. So a couple of pieces that you should know if you're considering traveling internationally for spring break or any other time. it is still recommended that we don't travel widely because COVID-19 is circulating throughout the world, including a number of variants that may not be as prevalent here in the United States, but could be prevalent in whatever country you're traveling to. So it definitely puts you at risk anytime you're traveling, especially if you are gathering at places, not wearing your mask, or anything like that. So if you are going to travel, certainly do all of the recommended public health interventions, wear a mask, try to keep socially distanced from people you don't live with or aren't in your household. But be aware that if you're traveling internationally, you will be required to get a COVID-19 test prior to boarding the plane to fly back into the country. And they will be asking to see that documentation before you are able to board the plane. So that's going to be a really big piece. Now, if you get tested and you're negative, and this applies whether or not you're immunized. So even if you're vaccinated, you're still going to have to get that test before you can come back into the United States. Now, if you test negative and you're allowed to come home, it is recommended that you quarantine at home upon arrival. And again, the reason for this is you may be negative the day you get tested, but you could still have the virus in your system and it maybe just hasn't replicated enough to be detected on that test. So when you come home, it's going to be recommended that you stay at home for another 3 to 5 days, if possible, and then get tested. So it's the same thing we recommend if you've been exposed here to somebody. We recommend you get tested after day 5 of your exposure with a PCR. It's recommended, so not the rapid test, but one that's going to take about 24 to 48 hours to turn around, and stay home until you get that results. And if you get a negative result 5 days after you return, then you can go ahead and return to activities on day 8. If you don't want to get tested, then it's recommended you stay home for at least 10 days. Now, these are recommendations from the CDC. And so this is really about continuing to do what we know we need to do to protect our community from COVID-19. And again, this applies whether or not you're immunized, because there are variants, because you can still be exposed. And at this point, we just don't have enough data to say that if you have been vaccinated and you become infected, whether or not you can still spread the virus. So these are recommendations to keep in mind if you're going to travel internationally, but certainly would recommend maybe some local travel. Trying a nice road trip would be a safer alternative than getting on a plane and traveling somewhere outside of the United States.
And we will be providing more information and more guidance on those as especially as spring break and period is coming. We want it to be safe. We have made some gains, but we also understand that it doesn't take much for the trajectory to change and for those to be erased. So we will be sharing more information as to how to minimize the risk. But the key point is, if you don't have to travel, don't. There's a risk. While we are getting a lot of people vaccinated in the United States, there are several parts of the world that don't have those luxuries for now. So, and there are variants that are out there. Just need to be very careful. And if you must, then those guidelines are very important to follow those guidelines. So, Jody, that is the update from us. Just to recap that, it's the plans for next week. It's Tuesday is first dose for 80 plus. Wednesday is first dose for 65 plus. Thursday, second dose for Pfizer, and Friday, second dose for Moderna. We might work some other things into some other groups into Friday. And that's the plan. Starting from tomorrow, after you get your first dose, we'll provide you with information of when and where to receive your second dose, which is typically the same place, same time. That information, I'm moving forward. Beginning hopefully next week is when you book your first appointment, you get the information about when your second dose appointment. So hopefully those are things that are helpful to you, and we're, as always, very happy to answer questions that you may have.
Lots of news today and lots of good information. Thank you so much. I'm going to take a couple questions from Facebook, but I had one question, Elizabeth, when you were talking about the travel guidance. So when you were talking about the recommended quarantine after a trip, is that just for international travel, or is that also for domestic travel where you might have flown?
Currently, CDC recommends that for international travel.
Okay.
Now, PHE does have a few other pieces with travel guidance if you're traveling inside the United States, particularly if you're attending a mass gathering. So that's going to be considered something with more than 500 people where that distancing can't occur. So say you went to some big party or event in another state and came back, we would recommend that you quarantine from that. But at this time, KDHE does not have any quarantine recommendations for within the US travel.
Okay, great. Thank you. Okay, let's take a couple questions. Here's a question. Should you take an Advil prior to getting your vaccine?
Well, so some people have done that. Some people have taken acetaminophen, Tylenol, but there are also other people that don't recommend that in terms of for different reasons. We don't know fully the impact on efficacy or otherwise of the virus, but again, my suggestion at all times is when in doubt, consult with your primary care physician. But clearly what is true is if after taking the vaccine, and you have some of those symptoms, it's okay to take a pain reliever to address those. Of course, if those don't work, seek medical help. So I've had it both ways and haven't seen any major issue with both options. Yeah.
Great, thank you. Somebody says that they are an involved caregiver for their parents at times, and father is compromised. Any avenues for this person to get a vaccine based on that information?
We're working through that. We're working through getting better guidance around that. I would say that the decisions around that will be easier made after we walk through this huge group of 65 plus, like just several thousands. Well, so we do have several. Yesterday I was talking about developmental services and other JCDS, as well as other providers of such services in the county. Those are very important groups to us. Caregivers are very important. But so are several other groups. The more that we let phase 2 grow, the longer that we stay in phase 2. So it really all boils down to availability of vaccine, and everybody wants the vaccine, which we want. We want to want the vaccine. We want to give you the vaccine. It's just supply issue right now.
This might be a similar question, but when are people that have immune issues or health issues like cancer and their caregivers going to be on the list? Which phase?
If you're not 65, if you have, I think Elizabeth addressed some of that yesterday, depending on what pre-existing condition you have, whether it's defined as critical or serious, which will be phase 3, or not as serious. That's my choice of word, which will be phase 4. So the quick answer to that is you could fall in phase 3 or phase 4. And I think KDHE has done a good job defining those. That are, of course, you can't cover every condition here. These are very difficult things, and ideally we'll have enough vaccine where the need for the phases and prioritization will not be as important. And I think one good news is the news out today about Johnson & Johnson vaccine that should add to our pool of vaccine supply. And the more vaccines that we have available, the better the supply, the less important these different phases become.
We have a question about licensed school-age childcare workers who work for the YMCA and Johnson County Park and Recreation District before and after school care programs in the elementary schools. Are they going to be included in the upcoming licensed childcare clinic next week?
So we have sort of tiered out our childcare providers as well in order to just prioritize them. So we started with our home providers and emphasized their vaccination because it's usually a single provider who is caring for a number of kids. And so if that individual contracts COVID or is exposed, then it impacts a large number of families. We have then moved on to our centers because those are oftentimes younger children who are unable to mask effectively. And so we're trying to vaccinate the centers, so the larger centers who care for, usually infants through pre-K or through age 4 or 5. And as we're getting through that list, then we will start including the school age program. So you are on our list. You are included in our total that we are using to project out how many vaccines we will need. We have gotten in touch and sent surveys to the school age programs, and so we should have your information. If you are uncertain, please reach out to Aldana Chestnut or the Child Care Licensing Program, and they will be able to check to see whether or not we have your information. But absolutely, as we continue to do these clinics, it may not be this coming clinic on Tuesday, but likely the one after that, we'll be able to start incorporating our school age programs.
We have a question here, one more maybe that we'll take. How many vaccines are we supposed to receive this week from KDHE, including the doses for teachers?
I don't have we can tell you that the doses for teachers were 6 trays, three for first doses and the other 3 second doses. And that translates to about slightly over 3,300 doses. That I can tell you. This week, we have received vaccines. Last time I checked, staff are trying to sort out which ones are first doses and which ones are second doses. But largely, I expect that to be the number that we've been receiving, which is using 6 doses per vial. It's about 8,100 doses. And some of those are going to our health systems. Most of them we are directing towards our 80 plus, the 3 clinics that we have Thursday, Friday, and next Tuesday. So that should take us through what we have. And so the clinics for next week, Wednesday, Thursday, and Friday, will largely depend on what we receive next week.
And you should know that towards the end of this week, right? Thursday or Friday.
We should know what we will expect next week by typically tomorrow. We should know that, yeah. But as at 2:30, when we had our last meeting and asked, we have not received that information yet. So.
Okay. Well, we'll check again with you tomorrow.
We'll do that, yes.
So, all right. Well, I think that will be it for today. Thank you both so much for being here. Thanks to everyone on Facebook for watching and asking questions. We'll get on there. The ones that we didn't catch, we will answer them in writing the best we can, either today or into tomorrow. So please keep showing up and asking those questions, and have a great rest of your day. Thanks so much.
Thank you.